Welcome to Toledo Clinic TV. Our guest for this segment is Dr. Lawrence Monger, an internal medicine practitioner. Welcome to the show.
Well, thank you. Thanks.
How important is it to establish a relationship with a primary care physician?
I think it's incredibly important, and you should start off in your 20s having a relationship with a primary care provider. A lot of patients transition to me from 18 up, transition from their pediatrician. But it's just really important to have an ongoing relationship with a primary care provider from your 20s through the rest of your life. I've got lots of patients who have been with a primary care provider, and they're in their 80s and 90s now and doing well because they've had a doctor to see on a regular basis. So I think it's incredibly important. You get a chance to kind of go through your 20s and 30s and make sure all of your preventive health issues are taken care of in each decade, and just make sure you're up to date on the most important things to keep you healthy. So I think it's vital that you have a primary care provider throughout your life.
And how much of your role is education? You talked about some of those preventative things that you're working on, as well as treating.
So education is everything for a primary care provider. As an internist, I take care of a lot of diabetes, heart disease, those types of things. I take care of people who are really ill. But if I can educate you early about why it's important to keep your weight down, why it's important to exercise throughout your life, why it's important for us to follow your blood pressure and your cholesterol, why it's important to follow your blood sugar. If I can educate you about those things early on, we won't get into the problems that are complicated, with heart attacks and strokes and diabetes and those types of things. So education is everything.
And so if a person ends up needing a specialist, you really are able to help coordinate that care.
I'm kind of the quarterback as a primary care provider, and as an internist, most of your specialists, your cardiologists, your pulmonologists, all of those types of non-surgical specialties started off as internal medicine doctors like myself. We did the same training, and then they went on to just subspecialize in their field. So I know a lot about all of the different fields, and so it's important for me to quarterback, as you said, to make sure that if they need a cardiologist, I do the initial workup and get you to the cardiologist ready to see them. If you've got something going on with your lungs, if you've been a smoker over the years, I can get the lung function test done. I can do those kind of things and then get you to the lung doctor so that they can take care of you. So I am the quarterback. As people see all of these different types of specialties, I make sure that they send information to me so I know what's going on with you, as your primary, so I can make sure that it all makes sense to you as the patient. So
and you really focus on that relationship, the one-on-one relationship with the patient, seeing them through all stages of their health.
You have to. If I'm going to be your primary care provider, I want to see you when you're healthy. I want to see you when you're sick. I tell my patients it's important to see me when you're sick so I can help you through that as well and know what's going on with you. If you have to have an urgent care doctor over the weekend or something, that's fine, but I would prefer to see you to help you through all of those stages and all of those problems. So that's my purpose here.
And how often should someone come in to see you? It's an excuse, but you live a healthy life and you're busy, and so you put off maybe that doctor's visit.
And a lot of people do, and guys, unfortunately, are very, they don't come to the doctor very often, but it varies. If you have lots of medications, if you're on a lot of medications or have a lot of problems, it may be as soon as every 3 to 6 months. I see a lot of people once a year just to get that checkup and just to check in and to re-educate about what we need to do over the upcoming year. But it varies depending upon your medical problems. It varies depending upon how you're doing health-wise. So every 3 to 6 months to every year.
What advice would you have for someone who is seeking a primary care provider, someone who says, I need an internal medicine specialist? How do you go about finding the right one? Well,
as in anything, you go and meet the person and discuss your health with them, and there has to be a fit. There always has to be a fit. If you don't mesh with the doctor you're seeing, if you're not getting what you need out of that doctor, then you need to seek another doctor. That's perfectly appropriate. But basically, go and meet that person, talk to that person, and see if you're the right fit with that person. So.
Okay.
Yeah.
Good, excellent advice. Anything else that you'd like to share?
No, really want to emphasize the importance of getting a primary care provider, whether it's an internal medicine physician like myself, family medicine is our primary care providers as well. Get with a doctor, establish a relationship, and see that person regularly, and your health will benefit.
Excellent. Dr. Monger, thank you for being with us.
Yeah, thank you.
And thank you for watching.